So we're talking today about a new diagnosis of type 2 diabetes. You were just told you have new diagnosis of type 2 diabetes, or you have family history of type 2 diabetes. They panic. What happened? Is that a death sentence? Some people feel that. You're trying to understand what happened, why I did have this. What happened? What happened in my body? We know type 2 diabetes has this genetic background. So that means if my parents or somebody in my family have type 2 diabetes, I'm prone to this. What exactly do I inherit from them? Do I inherit a certain genetic problem? That's what we're trying to understand today. Make it very simple. Once we understand what happened in type 2 diabetes, then it becomes easier to manage it and prevent it and see where you're at. It is a combination of two things: insulin resistance, beta cell failure. So when you have type 2 diabetes genetics, you inherit beta cell that are destined to fail. And you have also insulin resistance, that your insulin does not work as good as somebody else who does not have insulin resistance. I'm going to show you on the slide here how in the picture, what is the meaning, or where is that problem. Part of this problem is a beta cell dysfunction. I mean, beta cell that are destined to fail and eventually reduce the insulin secretions, and that will lead to high sugar. Initially, the body will compensate, it will increase the insulin secretion from beta cell to cover up for the insulin resistance, and that's a problem that you face before you become diabetic. The second problem is insulin resistance. What is that word? What does that mean? Where is the problem of that insulin resistance? It is mainly in three areas in the body. One is the liver, where the liver is producing too much glucose. One is the muscle, where the muscle cannot handle glucose. And the third problem is in the fat tissue. To explain here in detail, this is a scale that will tell us what happened to the beta cell. This is a decline of beta cell function as we go at years after diagnosis, or after knowing that I have the genes that make me prone to diabetes. You can see when you lose around 25% of your beta cell, you become pre-diabetic. When you lose 50% of your beta cell, you become diabetic. And this beta cell failure will continue. So if you are anywhere on that curve, you say, if I'm here, I want to make sure I'm going to keep my beta cell intact, functional. If you're here, you say, I'm going to prevent more damage to the beta cells. I don't have to take medication. If you're here, you say, I want to prevent more beta cell damage, so I don't have to take insulin. So whatever you are on that curve, there's a place where you can actually do better and protect your beta cell. So the first part on insulin resistance, how do I improve that? What can I do if it's genetic a problem? We will look at the muscle to see that there's a problem. When we eat, the glucose has to go. The first step, the muscle have to take it and use it. In order for the glucose to enter the muscle, it has to go through a door. If we have a problem with that door, that means the muscle cannot take the glucose in. The body has to respond by sending more insulin to push the glucose into the muscle to be used. Now that process eventually will give us a lower sugar. It will bring the numbers down, but on the long run, it causes a lot of problems. These problems we need to talk about to see just having normal glucose in prediabetes or diabetes does not mean I'm a better person, I'm a healthier person. So I'm going to show you in pictures on slide, how's that done. Normally when we have glucose, it goes to the liver. It goes into this very complex, don't worry about the numbers, you don't have to know any of that. Just knowing that glucose eventually produces energy. How's that happen? By a process called glycolysis. You get to this one step here called pyruvate. The pyruvate has to go into this Krebs cycle. The enzyme that is responsible here in doing all of that is pyruvate kinase. There's another one called pyruvate dehydrogenase. These are very important enzymes in controlling glucose production of energy. The process goes this way to produce energy or goes the opposite way to produce glucose. Is all based on the activity of these enzymes here. Now we know these enzymes are activated by insulin. So if you have insulin sensitivity, you're normal, you have family history of diabetes, you have no problem converting glucose into energy. But if you have insulin resistance and you are part of this huge group that cannot handle glucose very well, then that glucose does not go into energy. And on top of the amino acid and free fatty acid, this process can go and produce more glucose, and the sugar goes higher, and then the body has to produce more insulin to try to handle excess glucose. Exercise and metformin have been known to improve the activity of these enzymes and improve in transforming glucose into energy. The most important part in understanding what happened to insulin resistance is at the level of the muscle. Insulin activates the receptors. Tyrosine phosphorylation leads to this PI3 kinase pathway. Eventually, this will produce a molecule called GLUT4. GLUT4's job is to open that gate, bring glucose into the muscle. That means the food you just eat, in order to enter the muscle to be used, has to go through this gate, and GLUT4 is very important. I need insulin to activate GLUT4, but if I have insulin resistance, where is the problem? This is where the problem is. I have a problem in activating this pathway. I don't have enough GLUT4, so my glucose is hanging in the blood, cannot get into the muscle to be used. The body's reaction to this is produce more insulin, but we already know there's a problem. I have limited amount of insulin in my beta cell. If I overwork my beta cell, I'm going to be deprived of that insulin. Eventually, I'm going to have high sugars and diabetes. And not only this process by producing more insulin deprive the beta cell, but also can lead to activation of other pathways, one of the MAP kinase pathway. This pathway will lead to atherosclerosis, thrombosis. So the risk of clots and the risk of heart disease increase with more insulin production in your body. And these extra insulin can cause hypoglycemia, can cause weight gain, building more fat cells. There's connection of this insulin resistance also to cancer. To give you a summary of what happened to the muscle, that means I ate some glucose, the muscle has to handle it. If I have insulin resistance, I can't bring the glucose in. My body sends more insulin. Insulin forces the GLUT4 to be activated, bring the glucose in. Sugars are down, but there's tons of problems happening with this. One of them, I made my body produce too much insulin. And I've already told you, you have beta cells that don't have a lot of insulin, so I'm already killing my preserved insulin, make me closer to diabetes. Or make me closer, if I'm diabetic, make me closer to lose more beta cells, or I will have to take injections of insulin. Second problem is that excess insulin can cause hypoglycemia. A lot of us, when we eat carbohydrates, before patients become diabetic, when they eat carbohydrate, the body makes too much insulin, and that will lead to hypoglycemia postprandially, after they eat. And they're forced to sample to eat again, and that will lead again to the same process with using more insulin, and this will cause weight gain eventually because I'm producing insulin and I'm eating with low sugar. Excess insulin can activate IGF-1 receptor, can cause cancer. Some of the GI cancer, colon cancer, stomach cancer, some of them are connected to insulin resistance. So the more insulin endogenously produced by your body, more cancer you're going to have. And also, if I can't activate PI3 kinase pathway, I'm activating MAP kinase pathway, and that will lead to thrombosis and atherosclerosis. So that means the more insulin produced, the more heart disease and clots I'm going to have. So a lot of people say, why do I have all these risks that come with diabetes? The heart disease, the clots, the cancer, the weight gain. It all becomes of excess insulin production in the body. So to be smart, if I'm anywhere on that curve with the beta cell, if I don't have diabetes, I'm pre-diabetic, or even before that, I have the genes for diabetes. Wherever I am on that curve, I need to make sure first I'm preserving my beta cell. How do I do that? By eating less carbohydrate, less sugar, putting less pressure on my pancreas. Second, I need to improve insulin resistance. And the best way to do it, other than just taking less glucose, is to increase the muscle mass. Remember with that slide what we said, the GLUT4 is activated. If we exercise, we increase the muscle mass, we increase more GLUT4 activation without needing insulin. This will lead to glucose going into the muscles that need to be burning the glucose because they are larger muscles. This will prevent not only the beta cell failure, but also prevent the cancer, the clots, the heart disease, the hypoglycemia, the weight gain that comes with it. So exercise that increase the muscle mass, strength training exercise is your best treatment to prevent type 2 diabetes, to prevent from going from pre-diabetes to diabetes, and also to prevent going from diabetes on pills to diabetes on insulin. Whatever you are on the curve, you could improve by increasing the muscle mass.